Morning to all of you. Now we are going to discuss about one of the congenital heart disease, coarctation of aorta. I am Saranya, Assistant Professor from Triple M College of Nursing. So the objective of this session is we are going to see the definition, function, incidence, causes, pathophysiology, clinical features, diagnostic evaluation, management, complications, and nursing diagnosis pertaining to this condition. So, as an introduction, what is coarctation aorta is? It is a birth defect in which a part of aorta is narrower than usual. If the narrowing is severe enough and if it is not diagnosed, the baby may have serious problems and may need surgery or any other procedures soon after the birth. So the proper definition is coarctation of aorta is a discrete narrowing of aortic arch, usually in juxtaductal position, that is, in the region of ductus arteriosus and left subclavian artery. Incidence. So the coarctation of aorta constitutes 7% of all congenital heart disease. So the causes of this coarctation of aorta is unknown. Sometimes it may pertain to the genetic reasons and Turner's syndrome. Types. First one is the infantile or preductal type. In this, the construction of aorta will be between the left subclavian artery and ductus arteriosus. Postductal, the second one, the construction will be at the distal to the ductus arteriosus. So this picture shows the preductal coarctation of aorta, and the second picture shows the postductal coarctation of aorta. So the pathophysiology is once the baby is born with the narrowing of the aorta, there will be mild constriction to total occlusion of aorta. This causes impedes the blood flow to the lower portion of the body. So what happens is there is an increased pressure to the proximal to the obstruction. That is increased pressure in the upper part of the body and lower pressure in the lower part of the body. The clinical features of this is it is symptomatic in infancy and rest age category it is asymptomatic. The clinical features increased pressure in the upper part of the body will show the patient having dizziness, headache, fainting, nosebleed and sometimes CVA, that is cerebrovascular accident. Then lower pressure in the lower part of the body will dispose absent or diminished pedal or femoral pulse. Next, weakness or pain in legs, cooler legs, molting, and babies going to congestive cardiac failure or failure to thrive infants will dispose some uh, symptoms like respiratory distress, poor weight gain, feeding problems, irritability, and tachycardia. Coming to the diagnostic evaluation. So, in examining a patient of coarctation of aorta, you can withstand first and second heart sounds are usually normal, no murmurs present or systolic murmur heard along the left mid to upper sternal border that radiates to the back. So this is the significance of the patient affected with the coarctation of aorta. Coming to the ECG, left or right hypertrophy will be seen. Then chest X-ray. Echocardiogram, Left or right ventricular hypertrophy will be seen in the echocardiogram. MRI and cardiac catheterization will clearly define the area and extent of narrowing. Coming to the medical management, continued antibiotic therapy as prophylaxis at least for 1 to 2 years. So there should be a continuous antibiotic therapy as prophylaxis to the patient, and next to the antihypertensive therapy. Next, coming to the surgical management. Here, the first surgical management can be done as end-to-end anastomosis. That is, the narrow portion of aorta is removed and two other normal parts are joined. This is the first surgical management attained. And next is subclavian flap aortoplasty. In this procedure, the longitudinal insertion is made in the aorta across the coarcted site and continued to the end of the distally divided left subclavian artery. The left subclavian artery is used as a patch or a flap to increase the diameter of aorta. Next come to the patch arthroplasty. The coarcted area is excised and a patch graft is placed on aorta to widen it, as shown in the picture. Coming to a balloon arthroplasty. A balloon catheter is introduced into the aorta during the cardiac catheterization and inflated at the site of coarctation to relieve the obstruction. So in this first picture A, you can see the resection, that is end-to-end anastomosis. And in B, you can see the patch angioplasty. And in the C picture, you can see the interposition graft. And in D, you can see the flap, that is a subclavian flap. So in these procedures, you can witness the aorta is corrected. Coming to the nursing management, you have to monitor the signs and symptoms of heart failure, because heart failure is common because of the decreased cardiac output or fluid volume overloaded. And you have to assess the fluid in the lungs, which crackle sound or difficulty in breathing, increased respiratory rate, fatigue or trouble feeding. And monitor and report the blood pressure. Monitor the pulse differences in the upper and the lower extremities. Coming to the complications, a weakened or bulging artery in the brain, that is brain aneurysm. Next, bleeding in the brain, hemorrhage, aortic rupture or tear, that is the dissection, aorta re-narrowing, that is recoarctation, possibly years after treatment, high blood pressure, aortic aneurysm or rupture. These are the complications the child may undergo. Coming to the nursing diagnosis, the child may have impacts following: risk for impaired liver function, urinary retention, disturbed sleep pattern, and decreased cardiac output. To summarize this session, coarctation of aorta is a narrowing part of the aorta, that is the main artery aorta. The heart must pump more forcefully to send blood through the aorta onto rest of the body. So aorta is the largest artery in the body. It moves oxygen-rich blood from the heart to rest of the body. So once it is coarcted, the rest of the body will not receive the oxygenated blood. So there will be alterations in the functions of the body, which may affect and give complications to the child. So this can be resolved by doing corrective surgery. So So references, and thank you for listening.